of 2025. And to begin with, I'd like to acknowledge the traditional owners and custodians of the country throughout Australia, recognising their continuing connection to the land, the sea, to waterways and community. And we pay our respects to them, their culture, their elders, past and present, and welcome any Aboriginal Torres Strait Islander people with us here today. So I think this is a really interesting topic that we have today. When I first spoke to Chris and Vicki from ARCAP around this, it's really clear, I think, that the group of participants and people that we'll be talking about today, autistic people with a co-occurring intellectual disability, often are put into a well-known basket called the too hard basket. It is something I think that a lot of people struggle to include people with autism and a co-occurring intellectual disability in lots of activities, including research, but also including having a say in their own life. And it's really great that we have Andrew here to come and talk from his point of view as well. In preparation, I just thought it might be interesting to acknowledge what's in the national roadmap, which is part of the National Autism Strategy, about improving the health and mental health of autistic people. There's a quote saying, autistic people are more likely than non-autistic people to have a range of other conditions, including intellectual disability. These additional conditions may mean that some autistic people need more support or different adaptations to access these services. Poor health and mental health outcomes for autistic people with co-occurring disabilities and or other conditions frequently occur due to diagnostic overshadowing, misdiagnosis, and service refusal on the basis that an autism diagnosis is beyond the capabilities of the service provider. So it's really, really great that we've got such great experts with us today. I'm really happy to have the National Centre for Excellence in Disability Health here, and also just want to acknowledge the good work that the Council for Intellectual Disability have also done over the years. Let me move now. We'll introduce some of our presenters and then come on to the recording. So first up, we have Julian Trollor. I think many people would be very aware of Professor Julian Trollor, Director at the National Centre of Excellence in Intellectual Disability Health at New South Wales. And it's a really, really great centre that really aims to improve health policy, practice and supports for people with an intellectual or developmental disability. Julian, thank you so much for being here today. It's really great to have you. We have Vicki Gibbs from Aspect. Vicki is a clinical psychologist and head of research at Aspect, has a not so young son now who is autistic, and also has a very wide range of research interests beyond intellectual disability, including criminal justice, employment, educational, financial well-being, and self-compassion. And last, but certainly not least, we have two presenters. Andrew Radford is an advocate for people with autism and intellectual disability. You may have seen Andrew on ABC TV's Assembly, where he was very much a star of the show. Andrew was also part of the Autism CRC's Future Leaders program, and last year became the first person with an intellectual disability to be appointed to the Disability Trust Advisory Board, to their board. So Andrew, congratulations on that. And Kathy Harris is the parent of an autistic son, founder and general manager of a day program for young autistic adults. So it's really great to start thinking about life as an adult and about work and day programs. The Campus Life program we'll hear about gives young people an opportunity to experience life at a tertiary campus. So really continuing education, which we know is really important for all. Thanks to Andrew, thanks to Kathy for being here. Okay, we'll get on with the pre-recorded presentations and we'll see you for the Q&A at the end.
Hello, it's an absolute privilege to be with you today. I'd like to acknowledge I'm on the land of the Aboriginal people, the traditional custodians of land here at UNSW Sydney, and that we're coming to the meeting from diverse lands of First Nations people, and pay my respects to elders past and present and those present today. I'd also like to acknowledge people with lived experience of disability and those who support them, including people present today. I wanted to start today by taking you through a little video about the new National Centre of Excellence in Intellectual Disability Health.
Hello and welcome to the National Centre of Excellence in Intellectual Disability Health.
We call it the Centre for short. This centre makes sure people with intellectual disability get better health care.
At the centre, we talk to people with intellectual disability to find out what they think is important.
We talk to families and support people.
We work with health services and disability groups.
We bring information together from across Australia.
We share information about how to make good health services for people with intellectual disability.
We make sure there is health information for people with intellectual disability, families and supporters, health and disability workers.
We speak up on the big health issues and drive positive change.
There are 9 main groups in the centre. We call this the consortium. There are also more than 50 wonderful partnering and collaborating organisations. People with intellectual disability are a big part of the centre. People with intellectual disability work at the centre.
We're excited about improving the health and well-being of people with intellectual disability. Please join us.
To find out more information, go to our website nceidh.org.au and sign up for our news.
Welcome to the centre.
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 Yay!
That gives you just a snapshot about the centre and about the joy in establishing the centre. The Disability Royal Commission concluded that people with cognitive disability were subject to systemic neglect by the Australian healthcare system. This is a scandalous situation in a country with a first-rate healthcare system. We know, and have done for so long, that people with intellectual disability can experience difficulties accessing healthcare and encounter professionals who are not well trained in this area and can experience poor healthcare. We know that people with intellectual disability experience a range of problems across different parts of the body systems that feed into this cycle of poor health outcomes. And so we think that the centre needs to respond to the diverse array of healthcare problems and the diversity of people living with intellectual disability, including those on the autism spectrum. When we think about how people with intellectual disability use services, we know that people are often high users of health services, and we know there's not enough attention to the way in which those services are equipped and the degree of sophistication in those health services. We also know that there's not enough attention on the prevention of future health problems for people with intellectual disability. So who is the National Centre? Well, our National Centre is different people working across Australia to make sure that people with intellectual disability have access to the healthcare they need. It's universities, health services, advocacy groups and First Nations disability organisations working together. And these are the consortium members you saw featured in the video. We also have 56 organisations that are partnering and collaborating organisations for the centre. And we're currently looking at our partners and collaborators and thinking about our future model of working together to ensure that we have a more flexible system that enables people to connect with us and our work. The centre has work across 4 different teams with really different but interconnected parts of their work. The Driving Change team really is that team that drives systemic advocacy. It thinks about how we need to change the sector, build capacity in the system, and thinks about the legislative and policy aspects of that change, and gets aside the relevant leaders in our sectors to help accelerate their thinking and progress. The Health Services Development team builds workforce capability by establishing communities of practice across health and oral health, disseminating information about models of care and supporting improvements in those models of care. So it's really driving innovation in that space. We're also keen to develop further clinical expertise in this area. The Resources and Innovation team leads the development of our Knowledge Exchange Hub, which really is a fancy way of saying a one-stop shop for people with intellectual disability, families and carers, disability and health professionals to access all the resources they need to ensure that the healthcare journey is the best it can possibly be. We're hoping that that Knowledge Exchange Hub will be launched toward the end of the year. The Research and Data team is establishing priorities for research in this space, delivering inclusive research training and research mentorship, and providing leadership in what needs to happen next in the research space, including with data, which is an important aspect of evaluating the performance of the health services system. The Centre does its work together with people with intellectual disability. There are many people with intellectual disability employed, including people on the autism spectrum with intellectual disability. The main office that coordinates this is through the University of New South Wales, but the work is collaborative and across multiple centres in Australia. We have 4 big goals. We want to be the leaders in intellectual disability health. We want to make health services better for people with intellectual disability. We want to make health information better so it's easier to understand. And we want to have better research about the health needs of people with intellectual disability and the solutions to that. So it's really translational research that we're aiming to stimulate. To give you a taste about what's happening in the centre, I'd like to invite you to come to our annual conference. This year, it's on the 3rd and 4th of July. It's both in person and online, so it's a great opportunity to connect with us. I'd like to turn our attention to the National Roadmap to Improve the Health and Mental Health for Autistic People to ask the question, how are the needs of people with intellectual disability represented in that roadmap, and then what are the implications as we think about how to work together in this space? If you haven't looked at the National Roadmap, please do so. It's a really rich roadmap that helps us know what needs to happen next. Firstly, there are priority populations named in the roadmap, including autistic people with intellectual disability. The roadmap acknowledges this area of complexity and that there might be additional significant barriers that need to be addressed in improving access to health and mental health services. There are several focus areas in the roadmap. Focus area A is improving support for autistic people, their families and carers in health and mental health services. And this area is really important as we think about how we improve that support for autistic people within services. But this area does include a specific mention and focus on people with intellectual disability. Focus area B is about improving the quality, safety and availability of autism-affirming health and mental health care for autistic people across the lifespan. And again, autistic people with intellectual disability are acknowledged within this focus area. Focus area C, building better connections between health and mental health and other services sectors, including the NDIS, is an area, again, that has a focus on those with intellectual disability who might require a more sophisticated way of working to make sure that the intersectional needs are addressed. Focus area D, improving autism education and training for health and mental health professionals, again includes actions to particularly address that intersection with intellectual disability. And focus area E is strengthening research and data on the health and mental health for autistic people and their families and carers. And again, we see a focus on those with intellectual disability. And I'll come back to this area of research and data a little later. There are major opportunities on our doorstep. If you haven't yet engaged with and explored what the National Disability Data Asset, known as the NDDA, offers, please do have a look at the website. By the end of the year, the build of the National Disability Data Asset, which is a third generation ready linked data asset, bringing multi-agency data together, allows us for the first time to see the needs of people with intellectual disability and autistic people living with intellectual disability. For the first time, analysis of that data then will allow us to look at things such as health outcomes for that specific group. One of the problems have been invisibility of these groups and underrepresentation in available data. And so I think this new approach to data linkage really helps us. There are lots of opportunities to think about research projects and ideas which may involve the NDDA, and so I'd encourage you. We are interested in research collaborations at the Centre, thinking about how the Centre can partner with particular endeavours, including in this area that we're talking about today. And I'm also open to suggestions about including our academics and staff as investigators on grant opportunities you may have. So please let us know. If you haven't looked at our website, please do so. It's linked there. You would be aware that there's a need, I think, to have actions now under the National Roadmap to improve the health and mental health of autistic people. And so we all have a role in advocacy for funding for initiatives under that roadmap into the future. And if you haven't looked at the National Autism Strategy, I encourage you, because government has already announced some initiatives and spends under that roadmap, and they're listed or summarised here. There's a total of just over $42 million pledged for the first phase implementation of the strategy. And I think that provides some opportunity to ensure that the needs of those autistic people with intellectual disability are embedded in those initiatives as they're rolled out. Please sign up for our Centre e-news. You can do so using the QR code or via the website listed below. And I'd like to thank you for your attention and the opportunity to present to the audience. And I look forward to our interaction in the webinar Q&A session today. Thank you.
I'm pleased to be able to share with you some key insights from our systematic review of studies that use self-report methods to gather the perspectives of autistic people with intellectual disability. This review was conducted by Aspect's research team in 2024 and was published in the Autism in Adulthood journal in December last year. Before we get into the details, let me give you a quick overview of today's presentation. We'll begin with some background on what we know about self-report methods in autism research and why we thought that a review of research specifically looking at these types of studies involving autistic people was important. Next, I'll describe the study aims, followed by the search strategy we used to find suitable papers for this review. After that, we'll dive into the key findings, highlighting the studies that we found, the nature of those studies, and the methods that they used. I'll also point out some limitations before wrapping up with the main implications of our findings for future research. So to our background and study aims. Autistic individuals have historically had limited representation in autism research. Many studies rely on reports from parents, teachers, or clinicians rather than directly engaging autistic individuals themselves. While these reports can offer valuable insights, they don't always reflect autistic people's own perspectives. When self-report data is collected, it's typically through verbal methods such as interviews, focus groups, or surveys. These methods may be inaccessible to some autistic individuals, particularly those with co-occurring intellectual disability. Given that approximately 30% of autistic individuals also have an intellectual disability, this lack of representation is a significant concern. In addition, there is growing recognition of the importance of community involvement in research. This means engaging autistic people, family members, and professionals in all stages of the research process, not just as participants. Involving the community can improve research methods and ensure that findings are meaningful and applicable to real-world contexts. Although autism research increasingly incorporates community involvement, it's unclear whether this extends to studies that focus on autistic individuals with intellectual disability. Our team felt that a systematic review of the literature was needed to assess the current research landscape in terms of studies that gather first-hand perspectives of autistic adults with intellectual disability, highlight any effective methods that address difficulties with accessibility, and identify gaps and areas of improvement. We hope this information would support the development of more inclusive research practices and ensure that autistic individuals with intellectual disability are not left out of important discussions about their own lives. Our study aims, we sought to provide a thorough overview of the methods used to collect first-hand information about the experiences and perspectives of this underserved group. Specifically, we wanted to determine the extent of the research focusing on the lived experience of autistic adults with intellectual disability using self-report methods, including the topics covered and the nature of the information gathered. We were guided by the following research questions. What is the nature and extent of the research using self-report methods where the focus is autistic adults with intellectual disability? What self-report measures have been used? What proportion of studies reviewed include community involvement? And we define community involvement as the active participation of community members, autistic adults, their family members, or their support networks in the conduct of the research beyond being just study participants. To our search strategy, the review was registered in Prospero, which is an international database that requires researchers to record their study plans before they start collecting or analysing any data. Searches were conducted in July 2023 across 6 databases, and we used terms related to autism, intellectual disability, and adults. We limited the results to English language articles in peer-reviewed publications in the previous 10 years. During the screening process, we reviewed the abstracts and then the full text of identified papers. Our selection criteria required that study samples comprised at least 70% autistic adults with intellectual disability, and the study had to include at least one self-report method from those autistic adults. So we identified just over 6,400 papers and screened them for eligibility, of which 277 full-text articles were reviewed. 263 of those were excluded for reasons such as not including any self-report measures, less than 70% of the sample being autistic adults with intellectual disability, or not meeting the standard of peer-reviewed research. And this left us with just 14 studies that we identified as eligible for inclusion in our review. We then analysed these 14 studies using a structured approach called narrative synthesis. This method helps summarise existing research, shows the quality and scope of the evidence available, and can guide policy or practice. We organised the data based on study characteristics, the measures that were used, and the key findings. So turning to our findings, apart from 3 papers in 2013, the studies had been conducted fairly recently in the previous 3 to 4 years. 10 of the 14 studies we identified were conducted in either the US or the UK, with remaining 4 studies from Ireland, Germany, and Hong Kong. The majority, 11 of the 14 papers, reported on outcomes from interventions. These interventions targeted social emotional competence, offending behaviours, health-related behaviours such as diet and exercise, employment skills, and 1 intervention was aimed at reducing social anxiety. About half of these intervention studies only involved a single subject. 3 were case series, 2 were randomised controlled trials, and 1 was a qualitative study. Of the 3 remaining studies, so those that weren't looking at outcomes of interventions, 1 explored increasing patient voice in mental health inpatient settings, 1 looked at the link between physical activity and quality of life, and 1 explored sibling relationships when one of those siblings is autistic with an intellectual disability. We pooled all of the studies to look at participant characteristics. In total, there were 157 autistic participants ranging in age from 17 to 57. Mean age ranged from 18 to 38 years. There was a higher representation of males compared to females. 11 of the studies provided some information about the level of intellectual disability of participants, and with those, all of the participants fell within the mild to moderate range. Only 6 studies reported on ethnicity, and from those, just over half were white, about a third were Asian, 10% were African American or Black, and the remainder were mixed race, Latino, or from Arabic background. All but 3 of the studies included informant measures in addition to the self-report measures from autistic adults. And these measures were completed by parents or family members, clinicians, staff, or support workers, or researchers conducting the study. So looking at the self-report measures that were used, a total of 24 measures were used to gather self-report data. Most of these were novel questionnaires or interviews that had been designed just for the purposes of that study. And only half of these were described as including accommodations such as visual aids, options for items to be read aloud, or the provision of additional explanation of items or questions if required. The remaining 10 measures were established questionnaires. However, only 2 had been validated specifically for use with adults with intellectual disability, and only 2 reported incorporating any adaptations. Although 2 studies documented some input in the design stage from siblings and employers of autistic adults, none reported any co-production elements that included the autistic adults with intellectual disability. Before discussing what these findings mean, it's important to acknowledge some limitations of this review. We only included peer-reviewed studies published in English, which means we may have missed relevant research from non-English speaking researchers. Additionally, we focused on studies published between 2013 and 2023, so older but still relevant research might not have been captured. We also excluded studies where fewer than 70% of participants were autistic adults with intellectual disability. This was intentional as we wanted to focus on this specific group. However, some excluded studies may still have provided useful insights in regards to self-report tools or promoting community involvement. Finally, we resolved disagreements through a discussion and consensus rather than involving a third reviewer, which could have introduced some bias or reduced the overall rigour of our review process. With those limitations in mind, and thinking about our findings, let's turn to some final thoughts on what the implications might be for future research. Future autism research needs to do a much better job of including the voices and experiences of autistic adults with intellectual disability. A key first step is to use inclusive methods to understand their priorities and support needs. Autism researchers can learn from the intellectual disability field, where the use of strategies like simplifying language, using real-life examples, avoiding abstract questions, and allowing flexible response formats is much more widespread. Finally, research needs to go beyond just evaluating interventions. It should aim to improve quality of life based on what truly matters to autistic adults with intellectual disability. This means involving them and their communities in research and what research is done. Genuine inclusion and collaboration should be a priority in shaping the future of autism research. Just summing up, our findings have highlighted how autistic adults with intellectual disability are often left out of research, with just 14 studies identified over a 10-year period. Most of these focused on testing interventions rather than understanding their daily lives, challenges, or priorities. We also found 24 tools that researchers used to collect information, but only 2 were actually designed for people with intellectual disability. Only about a half included any supports or accommodations like simple language or visual aids to make them more accessible. There was very little evidence of community involvement, with no studies incorporating co-production with autistic individuals. So while we have seen inroads in autism research overall in terms of co-production and prioritising lived experience, those with intellectual disability are still underrepresented in this kind of research. Future research needs to focus on developing ways for them to share their own experiences rather than relying on reports from others. Including them in the research process will help ensure that studies truly reflect the needs and priorities of all autistic people, especially those who are often overlooked. Thank you.
Yes, I have been directly involved in research. I've been involved with Aspect. I've been involved with Council for Intellectual Disability, and it's always been about what's the best for the person with the disability and how to help us.
My son has been directly involved in research through Griffith University. So the program, the day program that I set up was with him in mind, and it was a research project for the first 6 months and then continued after that.
So some really positive experiences are that we're always involved with things about us, and it's always like nothing about us without us is what I like to say, because it's about our lives. We have the same lives as everyone else. I've always had positive experiences in research, because what I find when we talk about research is things are going to get better. And on the negative part, which I don't really like talking about, is people don't really understand when they're talking to someone with autism or intellectual disability. And then they'll start talking to me like, when I say I've got intellectual disability, they start talking like a 2-year-old. And all of a sudden it just changes. So that's the only negative part I can come up with today.
Look, it was a really positive experience in that it was designed around him and his peers, and 50% of the group were non-speaking. So some of the questions asked were responded to with Trollor Code to Go, an app that changes pictures to speech. So that was really exciting. It could have been better, of course. It was the first time for us. I always think there's room for improvement.
So what's made it really easy for me is to have my information in easy read and information that is not big words but easy for me to understand and process, because then if it's in the way I understand, I will be able to participate in all the research that goes on, because in a way I understand, I feel comfortable. I'm on the board of the Disability Trust now, and for the first time in Australia, someone with an intellectual disability doing it, and they put all the papers in easy read for me. I think there needs to be a lot more with autism and intellectual disability. There's a lot on autism, but there's a thing not on intellectual disability as well as autism. And I think this is where we need to go, this is like a fantastic webinar, because it's talking about both and how people with intellectual disability need a bit more support than just with autism, and how we might need easy read and not big words, and everyone's different. But for me, like easy read, not big words, and just make it a lot easier for me to be involved. And I love being involved in research.
No, I don't think there's enough research for autistic people who have intellectual disability. I think they're often in the too hard basket. It can be very difficult to adapt tools to capture their opinions and their ideas, or to know if it's truly what they're thinking. You really need to have people very closely involved with them, also involved in the research, so they can vouch for their interests, their will, their preferences. Otherwise, I think it'll be a little hard, and it's probably why people avoid it. It can be quite difficult.
From my perspective, what I think's hard is that the information's not accessible. Like, someone might not know how to use, like, a computer, for instance, or the information's too many big words. It's not an easy read. Like, if it's like a lot of words on a piece of paper, I can't understand that from my perspective. But when it's in easy read, it's much easier for me to be involved, and I think, and I feel included as well when it's in easy read too. And then if we have it in a way we understand, we'll be able to go to more researching and find out what we need to do to make things better and have the best life possible.
I think sometimes researchers think people with intellectual disability don't have a lot to say. Often research is done to them or about them. And I would imagine that some of the barriers to including them in the research just really prevent them from even thinking about it. The communication difficulties can be very challenging, but I think it's really worthwhile, and you're starting to see a little bit more of it now. People with intellectual disability being involved actually in the research and having their voices heard. I think it's really important.
I think another could be, like, have a support person with you, and they can help with it as well. Like, the support person can say, okay, this is what they mean if it's not an easy read, or if they need someone to talk to, there's always someone there to support us, and which is wonderful.
I think something that would really benefit autistic people with intellectual disability in getting involved in research would be making accommodations, like getting them to contribute in a place where they feel comfortable, giving them more picture cues and processes mapped out, not surprising them with interview questions, making interview questions easy to understand, relating things to something they already know, and getting their families involved and their support workers, because they know them very, very well. And perhaps potentially using tools where they make a choice, this or that, or is it something else? Because it can be a little easier than sharing opinions and ideas.
I think people with autism and intellectual disability should always be part of research, because it's really important to find the best information, what's best for us. And also, I think too, what's a really good thing is to make sure that we understand what we're doing in the research as well, and always have a support person, easy read, or anything we need. And I think that would be really awesome.
I think it's important for autistic people with intellectual disability to be included in research because they are very under-researched. We don't know what their voice is. We don't get to hear from their perspective. So to really be inclusive, that sort of little niche group need to be involved. Otherwise, we're researching them and not including them.
I think people with an intellectual disability and autism will always be included when we have the information provided for us in a way we understand, and we can live our best lives possible, and nothing about us without us and our time to shine.
I've noticed that a lot of research about autism is primarily on younger children and school-age children. It's really exciting to see more research happen around young adults and older adults. They are sort of forgotten once they reach that adult phase. It's really important to hear what they've got to say. Sometimes it takes them a lot longer to reach milestones that other people reach in school. So it's possible that once they reach adulthood, that's when they actually have something to tell us.
Now, like in May, I'm going to have you heard of Spectrum Space in Perth?
No.
No. Well, they've asked me to go to a symposium. I'm talking about intellectual disability and autism,
Oh,
and then I'm doing a Q&A with Lee Sales.
oh, amazing.
Brilliant. Thank you so much for your patience going through that. I think it was really fascinating. I will get all of our presenters to turn their cameras on now, and we'll go through some questions that have come through. Fantastic. Thank you, Vicki. Thank you, Julian. Thank you, Andrew. Brilliant. Vic, I thought we might just come to you to start with, because there was a question which I think was very specific to co-production. There was a question just around how do you know whether a paper is co-produced or not? Is that something that is expected to be required or disclosed within the publication?
Yeah, look, when someone writes a paper, there is a section of the paper, the methods section, where they should describe the process that they go through from, you know, what measures they're using or how they've developed their measures, their procedure. And if someone has gone to the trouble of, say, consulting with autistic people or their families about, you know, a survey, for example, piloting a survey to make sure that they understand the questions, generally they would put that in that section. And increasingly, journals are asking that people actually have a set section of a paper where the heading is community involvement, and they're required to describe how they've engaged with the community in whatever way. And I guess what we saw in these papers, that there definitely were no headings with community involvement. And even when we sifted through their methods section to try and find some mention of any kind of co-production, co-design, it was you know, very limited, as we found.
Brilliant, thank you. I think the main question was one we had from Kana Grace, who's friend of the webinar and previous presenter, I think, around loneliness. And the question was around the differences or the unique differences between autistic people with a co-occurring intellectual disability and those without, and possibly particularly in the healthcare setting. So, Andrew, I thought maybe I could just start with you. You, I think, have given us some good information, but maybe there's a good chance just to reiterate that from your point of view, thinking about what you do in your advocacy. What do you keep telling people is the most important thing to do to make you included and successful?
Thank you, Tom. Andrew speaking. I think one of the most important things is to include me as a person, and also to make sure that we're always including anything that's always talked about us.
Fantastic. And Andrew, you talk about Easy Read. Can you explain like what a difference Easy Read might make to you in accessing a service?
So what Easy Read does for me accessing a service is it makes it so I can understand all the information. It's got the visuals and also easy English, or they might use a glossary, which I find much easier for the information that I need to get.
Fantastic. That's great. And does like a video also help you to understand things better? Yeah,
video form's good too, because you can actually see them talking about it.
Fantastic. That's good to know. And thinking about healthcare, so like, you know, when you've been to the doctor or the dentist or the hospital, is there anything that you would kind of say to recommend to people to make those visits easier or better?
I think what would be awesome is if they have a sheet in Easy Read to tell you what is actually happening, or they might or they talk to you as a person, or take a support person with you if you can't understand what's happening.
Yeah, great. That makes a lot of sense, Andrew. And it horrifies me to know that people talk down to you when they meet you, because that's just terrible. Yeah, indeed. Fantastic. Thank you. I'll take the same question. Julian, perhaps we can come to you next and say, I know you've worked across different cohorts. You've met many autistic people with an intellectual disability. What is it that's specific, perhaps, in a set of needs there in the healthcare setting?
Thank you, Tom. And what a really fascinating webinar this has been. I've seen some of the comments from the participants. It's wonderful. I've really learned a lot from Vicki and Andrew and Kathy. So thank you.
Thank you.
It's been great to be on a webinar with you, Andrew, and see you again.
It's good to see you too, Julian.
Yeah.
So, it's really good to see you.
Look, I think this is a really interesting question. I really worry that we think in boxes. And so one of the challenges here is, because of the way people with disability are supported and might receive support, we're forced to think in which label do I have, and to identify with that label. And often we speak with that language when we go into a healthcare setting. And what we must remember is that everyone is unique. I think in coming to a health environment, in talking with doctors and healthcare providers, it's important they understand us not by a label, by our disability type, but by how the sorts of things that can help us in our healthcare journey. So I think that's the first thing I'd like to get across. The second is that for people with intellectual disability, and whether or not they also experience autism, there may be a degree of communication difficulties as part of the cognitive difference for that person. And Andrew has just highlighted how important Easy Read it is, but there may be people who require other forms of communication adjustment to be involved in that healthcare interaction. And then I think when we think about the health needs of people, there are some similarities and some differences. Both people with autism and intellectual disability and people with intellectual disability have poorer health outcomes than the general population, but sometimes the reasons for this are different. If you think about preventive healthcare access, for example, the communication difficulties a person with intellectual disability and autism experience might mean that it's harder to engage with preventive health messages and understand them and to know how to access preventive healthcare. If I'm someone living on the autism spectrum with intellectual disability, I might have other challenges that mean I can't do the sorts of things that are required of me with preventive healthcare screening, for example, breast screen, or prostate examination if I'm needing that. And I guess I think there's also some differences in the mental health space. We know that people living on the autism spectrum have higher rates of anxiety and depression and thoughts of self-harm when someone is experiencing mental health symptoms, compared to, say, someone with intellectual disability. And some of the mental health profiles are, I think, unique. And some of the health profiles are also determined by an underlying cause. If someone has an intellectual disability that is related to a specific cause, for example, a genetic cause, and that can impact health tremendously. So there are some similarities and some differences, but I don't want us to think in boxes or labels. I want us to think about the person and their needs.
Brilliant. Yeah, that's great advice. Vicki, is there anything else that you'd wanted to add into what Andrew and Julian have contributed?
No, I think they've covered that question really well. Thanks, both.
All right. And perhaps, again, question for our researchers here. I think, Andrew, you may have to set up an agency of people wanting to collaborate with you, because I think there's going to be there's a good demand for you and your services, and for other people with an intellectual disability.
Yes.
Vicki, I think people are really interested in knowing a little bit about the how, like how do you co-produce research with somebody who has an intellectual disability. And there was a question about, are there any sort of validated tools? I know, Vic, that you talked a little bit about, simplified language, visual aids, concrete examples, et cetera, et cetera. Is there anything particularly you wanted to highlight from the research?
Yeah, I think it probably goes back a little bit to that co-production question. So having autistic people with intellectual disability, like Andrew, is going to be in high demand, part of the project design to start with. So, when you're even thinking about the way you're going to go about your research, involving them at that early point, and then using some of those strategies that you've just mentioned. But I mean, the autism field could really look to the intellectual disability field, because in many ways they're miles ahead of us. Because, and we talked about this beforehand, Tom, with the autism field, we have really opened up in terms of co-production and involving autistic people, but we do have the, I guess, benefit, if you like, of we can do that and be a little bit self-selecting about who we bring in. And I think there's been a tendency for autism researchers to look to autistic people without intellectual disability and to say we're doing co-production and co-design, but we've kind of got a bit of an easy out in many ways compared to the intellectual disability field, where they really have had to take those steps to think outside the box. So I think autism researchers can look to the intellectual disability field because they have been doing this and have got really good examples of novel and different ways to go about engaging people.
Brilliant, fantastic. Thanks, Vic. There was a question. I mean, it seems like collaboration is key here then, Vicki, from what you're saying. And there's a question around collaboration with New Zealand researchers. And perhaps the secret is to have people in the autism area connect with people like Julian, who has expertise in intellectual disability research, and make sure that together we lead collaborations. Julian, I don't know if there's a comment for you around that about collaborating. Do you collaborate kind of with other orgs to pursue research?
Yes, I would say Vicki's right on the money, though, with this idea we're siloed in our research agendas. And I do think we need to be specifically then thinking about those on the autism spectrum with intellectual disability specifically. Sometimes it's easier to think of a particular population and highlight that as singular, but this overlap is really important. Unless we take deliberate steps, apply for research funding in this space, it's just not going to happen. And unless we equip people with intellectual disability living with autism in the way that Andrew is equipped, and develop that researcher capability in the community, we also won't get the job done. We do need this to be co-designed, as Vicki said. I think we can learn from, I've learned a lot from the community with intellectual disability in co-design. It's not something that was part of my previous life as a neuroscience-based researcher. I do agree with Vicki. We can learn and understand from great co-production initiatives in intellectual disability led by many amazing colleagues of mine. Not me, but I think it's just amazing work. We should really be thinking, how do we adapt those co-production approaches and principles? Is there a need? Are they fit for purpose as they are? Or is there a specific need in this very area?
Yeah, fantastic. Thank you. I think we've probably got time just for one more question. Anything else, we will collate up and we'll put an email out to everybody and try and get information to cover everything that's in the chat. But there's just one comment about diagnostic overshadowing, I think. And I think, is that where, for example, if you get a diagnosis of an intellectual disability, people stop there and then fail to perhaps notice that autism might be a co-occurring condition, and then fail to find the right supports to match that diagnosis. Andrew, I just wondered with you, do you remember when you first got diagnosed, and was it autism first or was it intellectual disability first?
I think it was a bit of both, but I think it was intellectual disability first because there's a lot of things I couldn't really understand, and I wasn't speaking properly, and I had problem processing tasks and really sort of complex things. And then I had the autism diagnosis then, and it all sort of went from there.
Yeah. And do you think having the autism diagnosis, did that help you understand yourself a bit better and help other people understand? Yeah.
It did, yes.
Okay, fantastic. Vicki, as a background as a diagnostician, is that something, again, that has come up in your expertise?
Yeah, I'd like to say that probably doesn't happen as much as potentially it did in the past. And I think the way it probably worked in the past is that people were more easily identified as having an intellectual disability because, you know, we kind of understood that that was more clear, and then potentially missed out on an autism diagnosis because everything that was going on was just attributed to that autism diagnosis. But yeah, I think now people are, you know, certainly more aware that these are two separate things and need to be assessed separately and have different support needs. So I hope that things are, you know, better in that regard, but certainly that was something that was happening, you know, potentially when Jodie's child was younger.
Yeah. Yeah. Brilliant. Thank you. Well, look, I'm going to wrap us up for that. I just thank Julian, Vicki, and Andrew for such really engaging presentations. It was lovely to hear from you. And I think this is, again, one of those topics where it's more work to be done. It's really great that we've got the attention on this, and let's not let it go. Hey, let's keep pushing on and making sure we include Andrew and others. We might need more Andrews in the world to come and help with our co-produced research.
Thank you.